some of the partnerships that we have with third-party groups, I'd say, channel partners like our relationship with Accolade is probably a good example where they actually have access to that data, or they might be supporting a member with their care navigation journey, and through that experience might discover a need. So for instance, a member recently gets diagnosed with cancer, and through that cancer diagnosis might have an elevated level of stress, anxiety, possibly even depression. That acts as a trigger for them to then potentially refer that employee over to Ginger for additional services. So in some ways, it may not necessarily be through the employer who gives us that data, but actually working with third-party groups that we partnered with, like an Accolade or like other provider groups. We have a relationship with Kaiser Permanente and other entities that might know that information and are then bubbling up and referring those members to Ginger directly.
Can you just expand on that a little bit more? How you thought about picking channel partners, given that there probably, theoretically so many that you could work with. How did you think about your channel strategy broadly?
Hugely important. I mean, there is no doubt that this is a team sport, not only within mental health, but just more broadly in healthcare in general. And empathizing with our buyers for a second, they're now bombarded, if you will, with so many different solutions, not just within mental health, but across all these different verticals. And so they're looking increasingly for platform plays, if you will, or abilities to be able to roll up or consolidate or ensure that different solutions are actually engaging with each other and bidirectionally referring to each other. So we knew that was going to be a critical part of the equation, A. And then B, we often were selling to the exact same group that, for instance, an Accolade was selling. And, Accolade being a great example of a partnership that we decided to really go deep with, because we felt like they went deep with their customers, developed really strategic relationships, and were looking to bring more and more value to them. And we were looking for ways, to this line of questioning, to be able to drive utilization and find members who could actually get help from a Ginger, but might not have been thinking about a behavioral health solution, right? And so we knew we couldn't, we had to be selective. And so we went through and set up a set of criteria that largely had to do with making sure that partner was delivering meaningful value, that they had deep and meaningful relationships with their customers, that they could streamline or simplify the purchasing process. So, for instance, reduce contracting or other paperwork that would ultimately reduce the cycle from, deal or pipeline deal open all the way to contract close. I mean, those were all really critical parts of the equation. And then, I'd say finally, just a level of alignment at the leadership, really understanding and making sure that both teams were approaching the market in a similar way, and that they ultimately wanted to create an experience that got people better, that fundamentally was oriented around the member or the patient. And, you see a lot of these sorts of partnerships that are oftentimes largely, vaporware or, a deal in name only, but there's not really that next level. And I think it's something that we thought long and hard about, with the likes of Cigna probably being another great example for us, which is a really, really meaningful relationship where they've covered the cost of behavioral health coaching as part of that relationship. And it's been an unlocker for us to be able to find and support new populations that we'd have otherwise normally not had access to.